YouTube, thank you so much for watching. So for today we're actually going to talk about the coronavirus and breastfeeding. We're going to talk about some CDC recommendations and how you can protect you as well as yourself during this whole pandemic. I really hope you enjoy this video. Don't forget to subscribe. Please do. That's the best way that we can help to grow this channel and help to get this information to those who really need it.
Mommy, did you know?
Now to start off, I just want to say that the coronavirus is a respiratory disease that's mostly passed on through droplets. Droplets means that when someone is coughing or sneezing, the disease usually passes in those droplets. Now they are viruses. Viruses are not cured by antibiotics. Viruses, basically, we just have to wait it out, have treatments to make yourself feel better. I just want to mention that because a lot of times people say, oh, let me just have some antibiotics, it'll make me feel better. And that's not exactly how viruses work. And then another thing to notice is that the coronavirus is passed by droplets. It's not passed by touching somebody. It's not passed by blood or anything like that from what the CDC knows. From the CDC website, there's still a lot that's kind of unknown about the virus, but we do see that it is passed by droplets. So now for pregnant women. So you're probably wondering, what will I expect when I have my baby if I were to have the coronavirus? And of course, for a good reason. So if you were to be pregnant and have the coronavirus or suspected to have the coronavirus, it's very important that you let your healthcare staff know ahead of time. Just call the doctor's office or call the hospital's office so that we can make arrangements, because we have to let the staff know, we have to staff appropriately, and we have to have the right equipment. And in order to protect you as well as your baby and those around you, it's very important that we know ahead of time. Now, for after you deliver, I'm sure you're wondering what's going to happen. So the CDC is recommending that once mothers who have coronavirus or suspected coronavirus, that they are actually separated from their baby at birth. Now, of course, this was never the plan. It's never anybody's plan. And of course, it breaks my heart to have to see moms and babies have to be separated for whatever reason. But because it is passed by droplets, by being close to your baby, you have the tendency to pass those droplets onto your child. Now, if, let's say, mom and baby are not separated, whether it's from mom's choice, because of course, mom, you have a choice in this. If you do not want to be separated from your child, that is fine. In which case, the CDC does recommend that you can breastfeed with a mask at all times and that you practice hand hygiene. Hand hygiene is not only the hand sanitizer, but it's also using the hand washing techniques. It's very, very important. And then if you are rooming in with your child, you want to make sure that you are not close to your child. So basically what that means is that you use mechanical barriers as possible, you use curtains if you can, and practice, of course, 6 feet between you and your child. So basically what you will expect is one of two ways. One is if you accept the CDC's recommendation to be separated, you will probably stay in labor and delivery or another isolation room, and your baby will be sent to either the NICU or pediatrics for their isolation room. And then, of course, you would be able to pump. That is the CDC's recommendation, is to pump. And you can either, depending on the hospital's policy, some of them are allowing you to give the baby the breast milk, and others are having to wait until you are actually discharged. My hospital is actually waiting to offer the milk until you are discharged or cleared. Or it could be based on your pediatrician's orders as well. So at least you kind of know what to expect, and hopefully that kind of eases your concerns, because of course all of this is unknown and we are definitely heading through uncharted territories now. But I really hope that this is able to kind of ease your pain. And then, of course, let's say you do not want to be separated and you want to stay together, which is understandable. I have 2 kids myself. If I had to have my baby and not even be able to hold it, I don't even know, I can't even comprehend. So of course it is your decision. Now, if you are with your child, you have to protect your child. You have to protect your baby. Faith, I am a woman of faith, and I know that faith is very important, but you also have to be wise. So wise intelligence, you make intelligent choices. All right, let's say you're breastfeeding, wear a mask. Don't just breastfeed without a mask, without protective barriers for you and your child. Some hospitals might even ask you to wear the isolation gown if you are breastfeeding as well. Use whatever recommendations and tips and tricks that people are giving you. This, like I said, is uncharted territories. So you kind of just will play it by ear, and of course the CDC is always posting new recommendations as we go, and I will definitely put updates as well. Thank you so much, and make sure that you subscribe to my channel, and I will be putting more updates and helping you with tips and tricks to breastfeed as well. So don't forget to subscribe.